Over the next few minutes, I'll be presenting our reflection on a 10-day community-based placement at Benfizio. Our approach to this talk is rooted in the 2010 WHO CBR guidelines, specifically looking at how private practices manages its resources through the CBR management cycle. Benfizio is situated in a high socioeconomic community. This context is vital because it requires a self-sustaining financial model, which is a core pillar of program sustainability in the CBR framework. During our time there, we primarily observed musculoskeletal cases, but my expectation for this presentation is to go beyond clinical observations. I want to demonstrate how private sector leadership and mentorship can serve as a multi-sectoral strategy to enhance a community's quality of life. To understand the work at Benfizio, we must look at how CBR has evolved. It was initially promoted as a strategy to improve access to services in low and middle income countries by making optimum use of local resources. Today, it is a multi-sectoral strategy designed to address the broader needs of people with disabilities, ensuring their participation and inclusion. On this slide, you see the management cycle. At Benfizio, we applied this cycle starting with stage 1, which is the situation analysis, where we identified the urban community's needs and available financial resources. We then moved through planning and implementation, focusing heavily on health and empowerment components of the CBR matrix. By integrating these stages, we ensure that rehabilitation isn't just about treatment, but about restoring a person's role within their community. Now let's look at the real-world challenges we identified through our monitoring stage. On the left is the economic and implementation challenge. We observed the insurance rush, an external economic stimulus where patients book sessions before deadlines, causing a sudden workload spike. This risks service quality and causes therapist fatigue. On the right is our human resource challenge, the risk of burnout when therapists feel restricted to repetitive clinical tasks without professional growth. To overcome these, we identified the best method as effective leadership through monitoring and capacity building. In the monitoring stage of the cycle, leaders monitor workload of workers to ensure care remains prompt during the insurance rush. Simultaneously, capacity building empowers staff. A clear example of success is my supervisor, who through goal-oriented mentorship achieved her goal of building her own team. This demonstrates that when management invests in individual empowerment, it secures a long-term sustainability of the entire healthcare workforce.
Community integration and social participation in rehab. In many cases, rehabilitation is limited to what we call the clinical bubble. This means that the treatment is mainly conducted in a controlled clinic environment. While this setting is safe and structured, it often fails to reflect the real challenges that patients face in daily life. For example, patients may have to walk on uneven roads, climb office stairs, and commute to work. These situations are rarely simulated in the clinic. As a result, patients may perform well during therapy sessions but struggle when they return to their real-life environment. Another major issue is fragmented stakeholder synergy. This happens when there is poor communication between the therapists, employers, doctors, and family members. Without proper coordination, recovery plans may ignore workplace stress, job demands, or social challenges. These can slow down recovery and reduce long-term success. To address this problem, we propose a community integrated rehabilitation or CIR framework. The first component is environmental adaptations. This involves shifting from basic clinic exercises to environmental task specific training or ETST. These exercises simulate real-life movements related to activity daily living or ADL, such as climbing stairs, carrying objects, or walking on uneven surfaces. The second component is intersectoral advocacy. This includes implementing transition to work protocols, therapists provide formal progress reports, and workplace modification letters to employers. This ensures that patients return to work safely and with proper support. Overall, the CIR framework ensures that patients are not only physically healed but also socially and environmentally prepared. It promotes full reintegration into the community, improves quality of life, and supports sustainability recovery. In conclusion, effective rehabilitation should go beyond the clinic by integrating community-based training and strong stakeholder collaboration. We can help patients achieve true independence and long-term success. Thank you. In conclusion, the success of a private rehabilitation center like Beneficio depends on a strong dual-centric approach that focuses on both therapists and also the patients. First, by addressing internal workforce challenges through effective leadership, continuous training, and clear career development pathway, we can build a motivated, skilled, and sustainable team. When therapists feel supported and valued, they are more confident, more committed, and better able to provide high quality care to their patients. At the same time, by strengthening our connection with the community, we ensure that clinical recovery translates into real life independence. This includes helping patients return to work, participate in social activities, and manage daily challenges confidently. As a result, patients are not only physically recovered, but also mentally, socially prepared. When these two pillars are integrated, we create a strong and resilient rehab model that empowers therapists, supports patients, and benefits the wider community. With this balanced and holistic approach, Beneficio can continue to grow as a center that delivers high quality, meaningful, and community focused care. That's all from us. Thank you.